Welcome to today's edition of CESI Inside, and I'm particularly happy to be with Christa Sedlatschek. Christa is Executive Director of the European Agency for Safety and Health at Work, OSHA, located in Bilbao, Spain. And Christa is a medical doctor. She worked for the Austrian Labor Inspectorate and for the Ministry for Labor and Social Affairs in Austria, and also for the German Federal Institute for Occupational Safety and Health. Welcome, Mrs. Sedlatschek.
Thank you for the invitation.
You're a doctor by profession and you're the executive director of OSHA. How have you been experiencing the corona crisis? How do you experience it both professionally and personally? How do you see it, especially as a doctor?
Yeah, when the pandemic, so to say, started, at least for people, then I was in Bilbao at that time, and many of you know that the situation in Bilbao was, and I have to say is still quite difficult. So it was total confinement. That means for weeks I couldn't go, at least not out of the house, except buying shop food, and that was not very nice situation for several weeks. And for the office, that meant that we had to close the office in Bilbao, and we introduced quite quickly a protocol how we will deal with COVID, how to reorganize the work, which measures we have to take, and so we sent all our staff home, and still the majority is teleworking. We are only in phase 2 of our 4-phase protocol. That means that only 10% of staff is allowed to come to the office under very strict measures. So in the office, more or less every day, I see 5 to 7 people. But the majority is at home teleworking. Surprisingly, we were able to manage the work program. We are on time with almost all our tasks, and that's also because we provided the technical equipment, also chairs, tables, lights, and we are also paying for these facilities at home.
Ms. Sedlatschek, behind you I see the poster Lighten the Load. There was a campaign which was just started 2 weeks ago with a special focus on the prevention of work-related, I have to pronounce it correctly, musculoskeletal disorders. What are your expectations from that, from such a campaign? And we are a campaign partner from CESI. How can we contribute? What would you expect from us?
Yes, we launched this campaign together with Commissioner Schmidt and with the representative of the EU presidency 2 weeks ago. This campaign is dedicated to musculoskeletal disorders or diseases, and this is the 3rd time that EU-OSHA is organizing such a campaign. And this is, of course, the reason behind is that musculoskeletal disorders and diseases are the main reasons for long-term sick leave and for early retirement. Still, I would say it almost in all 27 member states, and therefore there is a need to tackle this topic. What we are doing in all our campaigns is we provide information to people, to employer, to social partner, to the policy level related to musculoskeletal disorders. What can be done to prevent the disorders? And what we do is an awareness campaign. That means we are closely working together with all member states, with our OSH networks in all member states, but also organizations like you, social partner organization, companies. So we are working together with a huge network of people interested in the topic. And of course, we encourage all our partners and our networks also to disseminate the information, to organize events or training, also for companies, for social partners, for experts, to spread the message. The message is quite simple. The message is musculoskeletal disorders can be prevented. And the measures we have to take at company, at workplace level, are quite often simple, not expensive, and therefore you can do a lot to prevent it. And this is a message, and then we provide information how to do it, especially for micro and small enterprises, for also, of course, big companies, but here with big companies, we are rather showing or showcasing what they are doing and their measures and their good practice example at workplace level. So important is raising awareness and then provide information what can be done.
And I suppose, of course, this campaign and this raising awareness now is even more urgent and important given all the COVID-19 restrictions, which kind of course, led with some kind of catalyst also to everything which is linked to mobile work or homework. Do you see a specific urgency now? And I know also OSHA is, of course, giving quite some guidance, also not only how to organize the work place, but also how to organize the return to work. I could imagine such a situation. OSHA is particularly in demand, or your services are in particular demand.
Yes. That's true. We quite soon after the lockdown, we received, but we did it immediately when we saw there is a need, to a request also from the Commission, from social partner, to get guidance how to assist people at home, sitting in front of the screen, and how they could organize the workplace, the working environment. And therefore we published several guidances on how to organize the workplace, what to also related to psychosocial risks, because people felt, and I think that's even deteriorating, they felt isolated, also to assist in sharing information, to be in contact with others. So several guidance, also COVID related, and teleworking, of course. And this we, if you look into our website, it's also accompanied by specific risk assessment at home. You can do via a checklist, a risk assessment, then people can deal with measures needed. And there, of course, it is the responsibility of an employer to assist the people at home, to provide information on what they have to do, also to be safe, and also how to organize the workplace at home. For example, we, the agency, we ask all staff if they have a need for ergonomic chair, table, screens, mouses, boards, and so on. And then we are providing these facilities, and of course we have to pay it.
And I guess also the employees also are being met with certain responsibilities on the employee side, because it's also a situation where I could imagine where many employers just are in front of a totally new situation, also overwhelmed, hence the importance also of guidance that you give. Can you just give a couple of information also as to the role, as the importance of the employees' contribution in this also?
I think the employees' obligation is it is important to communicate with the employer on a regular basis. As you said, employers are also in front of a totally new situation. So I think the exchange of information between the superior and the staff member is very, very important. Also give feedback on what they are doing, how the performance looks like, how many. It's difficult to let's say to say I'm working 8 hours at home. It's rather output related. That means producing papers or whatever is needed. So, but keep the communication to keep it on a regular basis with the employer. That's important.
So you say communication. Speaking of communication, this week is the European Week for Safety and Health at Work. What are your expectations from this week, this year, and this particularly crazy year? What do you think can be done still in the coming days, or what has been done so far?
I had the pleasure to open launches in several member states. This time it's quite easy because we are all having virtual conferences. So in all member states during this week, they start and launch the Healthy Workplace campaign. And I think important is, of course, also to get as many as possible into such a virtual conferences to inform and to raise awareness on the topic. Why is it so important? What to do? Whom to contact? How to work together with the OSHA experts? That means it is these are the conferences where you can start, and then we also describe what can be done. Also now under these special circumstances. And we have to touch, of course, the new working conditions at home, teleworking, and also give guidance. So what the expectation of such a week is that there is a first step to inform people, workers, employers, social partners, other experts, and then also to give advice what they can do. For example, our website is, I think, a very important single entry point for a lot of information. And we are follow up on what's happening at the national level. And I can tell you, so many member states and so many of our focal points are organizing conferences and events, of course, virtually all, but they are doing a great job.
Sedlatschek, just a side comment from our side, it's been a pleasure to work for your agency in the past also, and please pass it on to your colleagues also for their responsiveness. It was just lying a little bit on my heart. We represent a lot of so-called frontline workers, meaning in the medical sector, but also like security, law and order sector, police forces, emergency workers. These professions, these sectors, the workers, they are particularly exposed, of course, of infection. I mean, you have certain protocols also, but what would be a general, how could I say, key message to these key players at the forefront from OSHA, from you, and maybe also as a final comment, what would be your message to trade unions in general and to the CESI community?
What I think we all experienced over the last month, how important all these professions and jobs are. I mean, in German we say systemerhaltend, that these are the key persons and they're doing a great job. And I think there the social partners play an important role to make it visible what great job they are doing and under these very difficult circumstances. And then I would say and I see it at national level, for example, in Austria, that now also the trade unions and also all social partners are keen to discuss working conditions for these exposed people who did and are still doing a great job. And I think important is to acknowledge what they are doing, and to make visible also to the society and politicians, of course, that they deserve the acknowledgement. And of course, as a follow-up, and this is, for example, in Austria, also the discussion on working time or better salary. So there are some consequences, but this is not related to EU-OSHA. But I think most important is to make it visible, the great job, and then also the employer has to also recognize that there is a need for a good management of occupational safety and health, so that people stay safe and healthy.
Ms. Sedlatschek, thank you very much. Thank you for the interview. Thank you for your time. To you and the agency, all the best.
Thank you.
Keep on the great work. Keep on the spirit in these difficult times, and yeah, stay healthy. Thank you very much.
Thank you for your support, your partnership. I think this is very much appreciated by us.
Thank you too. Goodbye and stay healthy.
Thank you. Thank you.
Bye.
Bye-bye.
Bye.